Hello everyone and welcome to today's webinar on the topic, can digital tools reduce loneliness among older adults? Experiences from 3 Swedish cities. So very welcome to this program. My name is Åsa Ström Hildestrand and I'm Head of Communications here at Nordregio in Stockholm, and we welcome you to join us today together also with our sister organization Nordic Welfare Centre in a discussion about tools to reduce social isolation and loneliness, which has become a very timely topic during and after COVID. As you are I'm sure aware, this was a huge and increasing problem during the COVID pandemic, and we have now researched in a new report how this have impacted the use of digital technologies in healthcare or home care and homes for elderly in 3 Swedish municipalities, namely Huddinge, Eskilstuna and Storuman. And the focus is mainly on challenges and opportunities and how to make really effective use of these different tools. In which situations are they most useful? How can they complement real physical interaction in an inclusive way? Those are some of the questions that we have researched. We will also hear from our colleagues in our sister organization here within the Nordic collaboration, namely the Nordic Welfare Centre, who are digging deeper in this topic of health and older senior population and also welfare technology. But more than anything, we want to hear from you. So please use the opportunity to share in the Zoom chat function. If you work with any kinds of welfare technologies in elderly care, any experiences you have, any specific innovative projects, other development initiatives that you have taken in your municipality or region. So let us know, and we will have hopefully save good time for questions in a Q&A session towards the end of the program. Yes, and of course we will also share the recording from this webinar and of course the report, slides, presentations shown today, etc. By email to all of you who signed up to this webinar in the coming days. So more information to come. And again, yes, very welcome to join us in the chat. All right, I think without further ado, let's welcome our first speaker. So Johanna Jokinen, very welcome. So you are a senior research fellow here at Nordregio, and you're the main author of this report, but it's also been a teamwork, as I understand, with several people involved. But anyway, just the floor is yours. Very welcome.
Thank you, Åsa. So this report that was launched today is based on a project called Reducing Loneliness Among Older Adults in Times of COVID-19 and Beyond. And it was funded by Forte, Swedish Research Council for Health, Working Life and Welfare. There have been several researchers working in the projects, and they include Nora Sanchez-Casson, Linnea Löving and Sinan Wang from Nordregio, and also Sylvia Olsson from Mälardalen University, who conducted the case study in Eskilstuna municipality, and Åsa Holmner from Umeå University, who conducted the case study in Storuman municipality. And as also mentioned previously, so the municipalities of Huddinge, Eskilstuna and Storuman were included as case studies in this project. Owing to the ongoing process of population aging, social isolation and loneliness of older adults is a growing public health issue, leading to decreased health and well-being and social exclusion. While approximately 300,000 people were socially isolated in Sweden in 2020, older adults living in the elderly care homes felt lonelier by circa 10% than the ones living at home and receiving help from home care services. The outbreak of COVID-19 hit older adults hard and further aggravated these challenges due to self-isolation requirements in Sweden. At the same time, the pandemic also spurred digitalization in healthcare and social care sectors at a quick and disruptive pace. In Sweden, for instance, the use of digital healthcare services increased 10 times during the first months of 2020. In 2020, Nordregio researchers published a report called Digital Healthcare and Social Care, Regional Development Impacts in the Nordic Countries. And within that project, Nordregio conducted case studies in 7 remote regions in the Nordics. And the results of that report showed that digitalization in healthcare and social care had significant potential for enhancing health and well-being across the Nordic region. And it also boosted regional development and contributed to social, economic, and environmental sustainability. This current study is thereby based on the results of that report, further investigating how digitalization within elderly care can increase both social sustainability and quality of life and well-being of older adults. In previous literature, the introduced coping strategies to prevent loneliness have been divided in increased engagement in social activities and using time constructively in non-social activities such as gardening and reading. Previous studies also show that the most successful interventions included, for instance, productive activities instead of passive consumption activities. Previous knowledge regarding digital tools and their effectiveness on loneliness is rather limited. One review study showed that digital tools can be efficient in increasing social connectedness and decreasing loneliness on a short-term basis, even if they should not be used to replace human interaction in real life. It is also needed to conduct research with larger sample sizes and including ethnic minorities that are often exposed to loneliness. So the overall purpose of this study was to investigate how social care providers have dealt with the challenges of loneliness and social isolation of older adults during the COVID-19 pandemic by applying digital technologies. This study also sought to develop a better understanding of how the digital tools can be used in a socially inclusive way within elderly care. The main data collection method of this study involved conducting semi-structured interviews with the municipality officials, managing staff, and social care workers. We also interviewed older adults aged 70 years old and older, and we conducted approximately 15 interviews in each case study municipality. Afterwards, the interview material was analyzed by using a manifest content analysis approach, and we also conducted a mapping analysis of the case study municipalities. So now I will show some of the results of the mapping analysis. So first, we take a look of Huddinge municipality. Huddinge municipality is the second largest municipality in Stockholm region, population-wise, just after Stockholm municipality. And over 40% of the population of Huddinge municipality has a foreign background. Huddinge municipality has been participating in an EU project, Stockholm Digital Care, which promotes welfare technology that makes it possible for older adults to stay living longer at home. And this project was running already before the pandemic. In the first map, you can see the total population in Huddinge in 2019 in grid cells of 1 kilometer. As shown in the second map, the majority of people aged 80 years old and over live in the municipal center and the northeastern part of the municipality, which follows the pattern of the total population in the municipality. However, by calculating the share of the population aged 80 years old and over of the total population in each grid, we can see that the elderly people are overrepresented in the neighborhoods in the middle of the municipality, close to nature reserves. The second case study community, Eskilstuna, is a middle-sized municipality being located in Södermanland region, and there is a relatively large population born in Finland in the municipality of Eskilstuna. Eskilstuna municipality is one of the 10 model municipalities for the digitalization of the elderly care appointed by the Swedish Association of Local Authorities and Regions in June 2020. The first map shows the total population in Eskilstuna in 2019. The second map shows where people aged 80 years old and over live in the municipality, being concentrated in the central parts of the municipality. However, when we look at the share of the elderly people in the total population in each grid, relatively high share of the older adults can be observed in the outer sphere of the municipality, closer to the nature. The municipal center is more dominated by the younger population. And the third case study community, Storuman, is a peripheral municipality with a particularly low population density, being located in Västerbotten region in northern Sweden. While quite small share of the total population has a foreign background in Storuman municipality, it is a Sami management municipality with indigenous people. Storuman municipality hosts the Center for Rural Medicine, which promotes research, development and innovation in the field of health and medical care in rural areas. And they have been also working with digitalization of health and social care before the pandemic. The first map shows the total population in Storuman in 2019, and the second map shows that the living pattern of people aged 8 years old and over is similar to the overall population pattern in the municipality, with the majority of the old people living clustered in the four urban settlements. However, when looking at the share of older adults, they live in a more extensive geographical area within the municipality. There are a considerable amount of grids spreading out in Storuman, where the older adults are overrepresented in the population of each grid. Then I will tell a little bit of the results of the case studies. According to the interview results, based on the 3 case study municipalities, the pandemic has not been a particularly large driving force for a digital transformation in elderly care. In all 3 municipalities, the care providers had started working on certain digitalization efforts even before the pandemic broke out, as I told previously. As a consequence of the pandemic, however, it was necessary to make changes that required quick decisions to be made, and the municipalities also received state grants that enabled digital investments, such as the purchase of digital equipment. In addition, the elderly care staff tried to support the older adults in the use of digital tools, and digital meeting places were created to minimize the number of visits. At the same time, several previous digitalization initiatives needed to be postponed during the pandemic due to staff shortages and restrictions. Nevertheless, the pandemic has created an understanding of what needs to be done to digitize elderly care, and it has also shown weaknesses that need to be taken care of. The biggest challenges include insufficient skills, both among the staff and the older adults. The results also highlight that it is very individual how the older adults have experienced the pandemic and the use of digital tools, as well as the impact on social isolation. Thus, it is important to examine carefully which services should and should not be digitized and maintain flexibility for individual needs. In addition, the results show clearly that it is difficult to replace physical contact with relatives and friends with digital tools. Yet, the increased use of digital solutions can free up resources that can be used for other efforts. The results also show that the introduction of digital activities alongside regular physical gatherings can also help to include more older adults in social contacts. Thank you.
Very good. Thank you, Johanna, and the team, all the other writers, contributors from the municipalities. I think it is, to me, quite surprising that the pandemic wasn't a bigger driver of development of the digitalization, despite also extra state funding, as you mentioned. So, were you surprised, or did you, when you read about it more in depth, did you understand why? Or I don't know if you wanted to elaborate a little bit more on that.
Yes, I think I was surprised that, but at the same time, we could also see that. The digital tools that they were using already previously were started to be used in a more efficient way.
Okay.
And for instance, in Eskilstuna Commune, so they had specific staff who only were working as helping the older adults, and also the staff how to use these digital tools. So there were also some improvements, but we could say that it was the pandemic was not driving force for new kind of digitalization,
but maybe to really make sure the existing equipment works.
Yes,
and you also mentioned that the skills issue is one of the big obstacles towards development here. So that's maybe a recommendation. So if you would point out any specific learnings here for other municipalities who are interested in developing their digital tools, to have a person like this in Eskilstuna who would really teach both elderly and staff how to use tools sounds very useful. Were there any other such findings that you could highlight from the different municipalities?
Yeah, I think in Huddinge municipality, so they started to use night cameras in a more efficient way. And even if that did not impact the loneliness of older adults, but in that way they could free up more resources for other kind of activities that could help the older adults to feel less lonely.
Less lonely. And maybe more secure as well. That someone is watching, someone can see you if you fall or something happens. Yeah. I was also surprised. I think at Nordregio we do a lot of maps, and that's really a core thing that we do, and we like to look at the different geographies of regions and municipalities, and you show clearly with your maps that there are very different situations for elderly people in these different municipalities. Still, the results are pretty similar, as you mentioned. I don't know, what's your reflection on that? I mean, it does seem, it's very different. If you live in Storuman, it's a much higher risk that you actually live in loneliness, also geographically, that it's a very sort of spread out the population. While in Huddinge, for example, you're part of the big city area here in the Stockholm region. So I don't know, what's your reflection on the similarities despite these geographical differences?
Yeah, I think we could see that it looked more or less the same in all the municipalities, but of course there were some differences as well. And for instance, in Storuman municipality, so there were, I think there were more problems with the digital infrastructure. That for instance, in the elderly care homes, so the infrastructure, the Wi-Fi did not cover all the building, and that was problematic. In particular in this sparsely populated municipality.
Yes, that's something one could imagine. And also that we know that in Västerbotten is a lot of work going in that direction to increase the coverage. What was the other thing? Yes, you also, I was also curious if there were any differences in the interviews when you talk to staff or when you talk to the clients, the older adults, in terms of which tools they like, or in how they like or perceive this idea of having more digital interaction instead of physical interaction. Do you have any comment on that, if there were different views?
In that way, I did not conduct the interviews, so it was the other researchers conducting the interviews. But I think what we could see was that I think there were quite many older adults that were not using digital tools at all because of various reasons. So that was perhaps surprising, and then some, for instance, people with dementia had some difficulties to use that kind of tools, and there were also difficulties interviewing those older adults. But what was surprising that that was found out when interviewing the staff. So when these digital meetings were introduced instead of the normal gatherings that are physical gatherings, so the staff could see that some older adults who were never before interested in participating in this kind of social activities actually were participating in digital meetings. So that was surprising, and it may be also a learning that it may be good to have different kind of social activities for older adults, both digital ones but also
so specifically probably
meetings.
then for people with some physical limitations would rather join an online event, and that could give benefits for them, for example. Well, that's very interesting to know. But otherwise then handle digitalization with care, we could say. So all of the elderly actually feel that they have a chance to participate, and of course see that there are very different preconditions within the older population as well. But thank you so much. So interesting to hear more about this, and you'll come back later for more questions from the audience. So keep on putting your questions in the chat function, and we'll take care of as many as possible of those questions as we move along. And Johanna can also join the chat now if you have specific questions, as we welcome our next speaker today. But thank you so much, Johanna.
Thank you.
Kaisa Kepsu. You are senior advisor at the Nordic Welfare Centre, and you focus a lot on different aspects of our social welfare system in the Nordic countries. But you now happen to develop a similar complementary project on loneliness and older adults. So we invited you to comment a little bit on the findings in this report, and also tell us a little bit more about the ongoing work that you do and what you're hoping to find, or how this new project can contribute to elderly care. So Kaisa, very welcome.
Thank you. Yes, great to be here. I will start by finding my presentation here. Yes, great. Thank you, Nordregio. Really good to be here. And as you said, Åsa, it really is, there's a lot of complementary things going on in our sister organizations, and it's a really great thing to be able to share them across these institutions. So my name is Kaisa Kepsu, and I work at Nordic Welfare Centre. And as Åsa said, we work in the social sector. And we have had a lot of work going on at Nordic Welfare Centre that deals with the health of older adults. And in 2020, we got an assignment from the Nordic Council of Ministers when the COVID was in full effect to bring attention to the social impact of the pandemic crisis. And there were worries that the effects of lockdowns and of the effects of lockdowns and restrictions for health and social care as a whole. So we wanted to explore, or we got the assignment to explore the experiences of social isolation and loneliness during the pandemic, and also look at examples of how we can prevent negative feelings of isolation. And the idea was here to see what lessons we have learned from the pandemic and to be better prepared for future crises. So in this project, we are in our final stage. We have 2 reports actually in press. So I will comment on this report from the perspective of this ongoing project at Nordic Welfare Centre. And in our project, our focus is not just on older adults. So we have a broader target group, and we are not just looking at digital solutions either. They definitely come up. So I have a few points on that from this project we're working on. So I will share some sneak peeks on results from our project. We will be publishing these reports in February, more exactly February 7th, in a webinar. So be on the lookout for an invitation for that, or look on the webpage of Nordic Welfare Centre. And I really need to emphasize here at this point that I haven't just been managing the project. The real work has been done by Professor Maria Artsen and her assistant Franziska Rothe at Oslo Met University in Norway, and journalist Mikaela von Kugelgen from Finland, who has compiled the report on learning examples. So it's really interesting to look at this report and see how the digital tools have been received among the care providers and also the groups that use them. And it's really great to see what this brings for the understanding of what needs to be done to digitalize the care. Okay, let's go to our project here. Okay, I will tell a few points just as background. This is a project that is divided in two parts. We have one report coming out that is a Nordic research review, and it compiles the experiences of social isolation and loneliness. It's a literature review of empirical studies conducted in the Nordic countries. And this is the one that's been carried out by Professor Maria Artsen and research assistant Franziska Rothe. And it looks at the impact from research. What does research say about the impact of the pandemic on loneliness and social isolation among different groups? And also looks at what this research says about which groups are particularly vulnerable to this, to loneliness. If we look at some results that I could disclose already, I won't tell everything. We see that the increase in loneliness was relatively modest in the first wave, but gradually increased the longer the pandemic lasted. And it's so important to realize also that the pandemic-related feelings of loneliness didn't just disappear immediately after the regulations were lifted. So this is also important to keep in mind when and calls for long-term attention especially for the most vulnerable groups. And in line with this report that is presented today, we see also, of course, that there's a large heterogeneity in the groups. There are people that need more interventions and that are particularly hard hit by the pandemic, and for the groups that research lists as especially at risk for loneliness, you will be able to look more closely in the report. But here also, not just one size fits all interventions, but tailor-made according to groups is what research says about social isolation and loneliness. It's not just negative, all the results in research either about the pandemic's effects on loneliness and social isolation. We see that the debate, it was highlighted, it was a risk that was highlighted throughout the pandemic, that people are left alone, and people were aware of this, and that stimulated a lot of people to stay in contact with people that were most vulnerable. And in those people who were isolated, we also see that there's that perhaps a feeling of being in the same isolated situation, and awareness of that may have increased resilience to loneliness, even among risk groups. The second part of our project presents some promising interventions that complements the picture of the research review. It shows a few examples of what was done to alleviate loneliness during the pandemic in the Nordic countries. We highlight 5 examples from different Nordic countries, and they're very different intentionally to show that there are many ways to tackle social isolation and loneliness. And in the next slide, here are a list of interventions that we raise in this report. Mikaela von Kugelgen, who is the author behind this report, has done research and to present these interventions. And among these 5 interventions, we see one that is particularly that is something about digital communications. That was the theme of today's report. And we present a simple one-button digital communications device from a company in Norway, a company called No Isolation, and they have produced this device or designed this device for people who have difficulties with digital technology, but want to keep in touch with people that they are not able to meet. And this device has been used in several care homes during the pandemic as a communications channel, and is, if you can say, user-friendly. It's very simple. There's one button that you turn to turn it on, and if you want to raise the volume, it's the same button that you turn. So it's very, very simple, and has received very good reviews from the users. And one care home in Oslo raised the same concern that came up in this report today, that digital devices also takes up a lot of extra resources from the staff. But in this particular home, they didn't feel that was the case with this device, that it would create extra work. But of course, there's not that much research on how that has changed loneliness, or measure that has alleviated loneliness. We just hear that some good reviews of this. And they have been, many older adults have been satisfied with this device. But of course, it's very simple, so it's probably the wrong solution for someone who is able to use a smartphone, for example. So this is particularly for people who have difficulties with technology. But it's a good example of a digital device that works. But for me, I would just leave you with the note that on February the 7th, we will tell more about this report or this project, and hopefully we'll see many of you there. We have also at Nordic Welfare Centre deal with loneliness and among older adults had a focus on that earlier, and on our website you can find previous webinars and also reports on the matter, but not with a pandemic focus as today. Thank you.
Thank you so much, Kaisa. And you'll come back as well for the discussion later, where we pick up more questions from the chat. I don't know if you had any other comments on, the relationship, what you hear about what's going on in the municipalities as what, based on what Johanna told us now. Are there any sort of contradictory things that you see, or would you say that it's not all about the digital tools, but obviously you have also looked at other interventions. So what do you think that the future will bring here? A better balance of using both digital and social interaction? Or I don't know if you have any.
Yeah, I think you put it well there. I think that's exactly what I think this project also shows, that you need different types of solutions, and some that also was raised in the report, that you need to meet people physically, but complement these with digital devices, and then of course what suits the target group. And we, for example, have highlighted one example about just more telephone service for people, so that they can talk to people about their problems, for example.
So different tools for different people, obviously.
Yeah.
All right. Thank you so much, Kajsa. We'll hear more soon from you as well. But for now, let's invite our third speaker of this program, and that is Bengt Andersson. You're also senior advisor at Nordic Welfare Centre, but you have focused specifically on welfare technology, and not just in elderly care, but in a broader sense, also in healthcare and care in a broader sense. And you also, I would also like to mention that you also have a special Nordic network, of a research network on welfare technology as well. So comments from you on this and the topics moving forward. What do you see in terms of innovations and usage of this? So,
Yes.
very welcome.
Thank you, Åsa. Yes, first of all, I think you need to check out this report and download it. It will be published today, I think. And just so you know, probably will be said further on, but it's in Swedish. It's a Swedish report.
That's very true. På svenska.
På svenska.
But then you can use and look at Johanna's slides as a way to get the good translation of the main topics.
Yeah. But it is funded by Forte and a Swedish project, and it's as we all understand then a Swedish context then. But just comment on the setup. I think it's very interesting that it's Huddinge, very close to Stockholm, very urban area, and then Eskilstuna. There's quite large city in the middle of Sweden. Middle of South Sweden, and then Storuman, that's very far up in the north, is very sparsely populated area. And I think it's interesting that to look at to have these three municipalities. And I'm also, as you was a little bit surprised that there are so many similarities from that perspective. But I think we need to read the report a little more in detail, and maybe we find some differences there anyhow. I also think that it's extremely good that the project also has managed to interview the target group. I think in a lot of projects and research done, we work with the staff around the target group. So I think it's interesting too that they are a part of the project. And when it comes to social isolation and loneliness, as the report and as Johanna said earlier on, I would like to highlight the fact that the older adults living in care homes, they feel more lonely. Their loneliness are bigger than older people not living in care homes. And in fact,
that's a very important point.
Yeah, because
that we would like to also hear from you if that's your experience. I'm thinking of the audience here, but how could that be? It's a staff issue then that you don't have enough staff.
Well,
so people are
because
left
they
in
are
their
not
rooms,
social.
or what's your hypothesis, or have you researched this?
No, I haven't. No, but I think it's important to highlight this because they are not sort of social isolated. They have people around them all the time, but they feel lonely. So I ask myself, do we focus on the right needs? Do we focus on the right things in care homes? So maybe we don't. But at the same time, I will highlight from the report again that one of the most why people have to move into in care homes. One of the most often reason is dementia, due to dementia. And it's highlighted here that both Huddinge and Storuman, they have been working successfully with digital solutions just for people with dementia and their loneliness. So it has been successful as an example. I think that's very good.
Although it was also mentioned that it can be more difficult to teach them. I mean, depending on their cognitive abilities, right? So
you need to have the right tool to the right person's needs, of course. And I think that the needs are really something that we should focus on. I have an example here where it goes wrong. It is an example from Denmark a couple of years ago, where they built a new in-care home, and they started up with, they said that this must be the most advanced and technically digitalized in-care home in Denmark Northern countries or even the world. So they built in a lot of technology and a lot of digital services. And then the older adults moved in and the staff began to work. And they didn't use anything of this because it was not built on their needs of those persons that were there. So I think that is something that we have to, we need to what we do, it must be based on needs and individual needs. And then it's important to be successful is, for example, looking at the needs, but also looking at in the organizations, it's a lot about culture. We need to work with change management. It's very little. I'm as a senior advisor in welfare technology, I often say that it's maybe 10 or 20% about the technical things. It's 80-90% of why we don't manage to use digital solution is more into culture in organizations and change management. And we know, for example, that they in Norway have been very successful working with something called Veikart for tjänsteinnovation or Roadmap for Service Innovation, a tool. And I think they must mention that the first phases of the 6 phases in this Roadmap for Service and Innovation is insight and anchoring. You need to get insight and anchoring. Insight, what needs do you want to fulfill when we establish this digital services, and then anchor that in organization with target groups, with next of kin, relatives, etc. And I think as Johanna mentioned in her presentation there, we're looking into that the pandemic hasn't had that big role, but I think when it comes to insight and also a part of anchoring, that as you said, Johanna, that it has made an understanding that digitalization of services are necessary for reasons. And so I think even though it shows in this report that it hasn't been that breakthrough really, but it increased the understanding that this is on the path we need to go.
Yeah, and it has increased the usage, even if not many new tools were introduced. It seems like more of the existing tools were used maybe in a more effective way. Yeah. Because the need grew. Yeah. Simply, probably.
Absolutely. Yes. Yeah. And then what needs to be in place when it comes to, I think we mentioned that as well. I think the first thing is digital infrastructure. I know you do very nice maps here at Nordregio looking into broadband access of all Nordic municipalities, over 1,000 municipalities in the Nordic countries, and we look into how are the accessibility to high speed broadband. I think that is, and we can see that, for example, in sparsely populated areas that we haven't that in place. But if we don't have that in place, we should really have mobile net, 4G, 5G broadband mobile net, but that also hard to. So I mean that's the prerequisite to use these kind of. And one thing I think was highlighted in the report that is, I know that is in all in-care, very many in-care homes in all Nordic countries, there are not Wi-Fi enough. There may be Wi-Fi in some parts of in homes, but not in every room, not in every apartment. And I know there is a lot of going on, a lot of working on to how to establish this. I think in the context of Sweden, there is the people that lives in the apartments in care homes. They sort of rent these, and they sort of have their. Right. Should they have their own Wi-Fi, or should Wi-Fi be a part of the in-care home? I thought absolutely it must be a part of the in-care home in the services. So, but I know there's a lot of municipal organizations struggle with this around the Nordic countries. But that is the first thing, because when we look into using mainstream services, that is a second. How can we get a higher number of older adults to easier use the opportunities that are available? And that is both wherever you live, but especially if you live in care home. And then we talk about digital excluded individuals. And what we see if we look at statistic, that is for me surprising, that there's something called svenskarna and internet, Swedish and the internet.
This actually now comes to one of the questions.
All right.
I wanted to save them for but we start the discussion, the Q&A here, because it's a question here in the chat. What percentage of Swedes 65 plus are using the internet today? Do we know that? And it sounds like you do.
Sorry, I don't remember exactly, but yes, we do. There is something called Swedes and internet is .se that presents results every year, and I can see I've been working quite a long time with this. I know we said for 10 years ago that the ones that are 65 now, they are digitalized through many of them through their work. They have smartphones, they have computers. They will still be as digitalized when they retire.
Yes.
But that's not really the fact. We can see that the people plus 75, they haven't increased that much that we thought, the number. So it looks pretty much the same as it did 10 years ago. So they are, they lose their digital skills. Some of them do.
Okay.
After stop working. And that's surprising. As I see
it's
it.
another challenge.
I think it looks the same in all Nordic countries. So not just Sweden. So
what could be the remedy to that? Do you have any Nordic examples how to upskill people then through Senioruniversitetet?
Yeah, I think there are several activities. I think the organizations, retirement organizations like PRO in Sweden and SPF, they work a lot with this, and they have been working a lot with this, but they don't reach all. So I think that is, and I know that it's coming up a project here at Nordregio, starting up this year that would look into this, digital exclusion and digital inclusion, and how to handle that. So more to come. More to come
on that topic for sure.
Yeah. But I also think anyhow that it's been highlighted again in the report that there is the report shows that it is increased use of tablets, iPads, such, and smartphones due to the pandemic. So the pandemic has a positive impact that the people that can handle these mainstream technologies on a higher degree than they did before the pandemic. So that's very good. But when we go in then to municipal services, why is in fact it going quite slow? Again, back to change management, that culture, etc., digital infrastructure. But there are a lot of very good services out there. I mean, we heard a very good example from Kajsa here, the one button tablet that you very easy to use. That is very broadened in Norway, both as a mainstream project, but also used in municipalities, both in home care, but also in home care in homes. So that's I think that is a very good example of how the simplicity is. Just one button. I mean,
that would be interesting to hear also from you in the audience if anyone is using that kind of device or similar. So beyond or besides tablets and iPhones, regular, that there is also equipment that is more targeting. And it's really interesting because my mother-in-law happens to be using this comp, and it's a fantastic tool, I must say, to also for the whole family to upload photos and videos and things that she can just see throughout the day. Just, it's like a little TV screen that is on, and we share things, and then with one button on our app in our phone we can call her through this video device and say hello and see how she's doing. So it's actually, it is very user friendly. So we'll see how that can spread. Is that your mission to also make sure to spread these good solutions across the Nordic countries, or what is the main mission with your project moving forward?
Yes, absolutely. I mean, it is looking into the why it is so hard to scale up I mean, it is hard to scale up. We have a lot of very good examples. We have a lot of good solutions that's been out there for quite some time, but it's very hard to scale up. It's very hard to broaden up the implementation. It's hard to pace up, have a high pace when it comes to doing this. But we'll need to go further on. I mean, there's a lot of good examples. We have activities. I think where I started about the loneliness feelings in care homes, we could see that there are, of course, many examples of in care homes that are very successful in activating and making a very good everyday life for each person that lives there, including digital solutions. There are organizations using, for example, VR glasses for
that would be fun
for traveling
Definitely.
around. But it is. There is a lot. There are several that use physical activity. You can go bicycling on your home street on a video, bicycling around. You could do that. I mean, that's the physical activity combined with also something very positive to see on an everyday basis. But again, it takes time from staff to do this. You need to have a certain focus. You have to decide that you need to do this. So I mean,
it comes down to the resources as well, and that's of course for government funding that's needed, probably extra funding, but also for the municipalities and their priorities, and that's another thing. But maybe then through collaboration across municipalities, that's another way forward. I think I'll stop you there for now and just ask our other two speakers, Kajsa and Johanna, to come back here and join us for this final part of the discussion, where we will pick up some other questions as well from the audience. I don't know, I can stand like this maybe. A little squeezed here in our studio. So anyway, we have got several questions, and hopefully I can read them without my glasses. But two of them we already touched upon here, that with a new generation of older adults coming who had more use of digital devices during their working life, the situation might change. Is that what you think, or is that what we see? And I don't know if Johanna or Kajsa, if you also wanted to comment on that. I mean, it was like a mixed picture if we ask Bengt here, but I don't know if you think that would be or it wouldn't be so surprising if a new generation would come up. But I don't know if that was part of your study of the development there.
I think we could see quite many comments from the interviews with elderly care staff, for instance, that at least they hope that it will be easier in the future when the next generation is more used to the use of digital tools. But of course, it may not be the case as mentioned by Bengt.
Because otherwise the skills issue is a limitation that has to be handled. I don't know, you have also looked at a broader scope of different interventions. I don't know if you want to
we saw,
comment on
for example, that social media was important for many younger age groups.
Right.
But we don't, I'm not 100% sure what the results was, if there was anything that said about older adults and use of social media.
So I think we might see much more TikTok video recording going on in elderly care when at least our children's generation grow up, right? They grow older. So I think, social media probably, we haven't talked so much about that today, but I think that's also worth exploring, because as a way to definitely break that isolation that we talk about. Yes, and the other thing, why, another question here from the chat, why isn't it, doesn't the digital tool seem more efficient in curbing loneliness and isolation? What do you have any comments on that? Why isn't it more efficient or more effective to use digital tools than you might have hoped? I don't know if you have any. This is speculative, I guess. Or did you get anything from the interviews here?
I've been looking at the interview material. So as I mentioned previously, it's quite very individual how these interviewed older adults were experiencing the period of the pandemic and the loneliness. So it seems that there were some older adults that were not that much affected of it, and then the other ones were very much affected by the feelings of loneliness. So
and depending on that, it might
yeah,
be
I think
different also
it
how
may be
you
different as well.
how you use or how you experience the use of digital tools. Yeah,
but it was possible to also see that at least in some cases, so the use of digital tools was also helping and decreasing the feelings of loneliness in some degrees.
To some degrees, yeah.
I say more research is needed. We see at our research network that you mentioned, we have 75 researchers, and we look into the research that is done overall when it comes to health and welfare technology. It's often very, very small studies. It's not so many number of individuals in the. We need more randomized studies. We need more focus on. So and again, the measuring the effect of loneliness is also maybe hard, but it could be done. There are research done there, but we need more research, especially when it comes to using these kind of tools that we are talking about. So, and there is research going on, but if there is anyone out there that have results, so please send us.
That would be interesting. What else do we have? 80 to 90% of elderly in Iceland use internet and computers every day. So Iceland might be leading the way here. This would also be interesting to see the numbers, and maybe that's something we can look at also in the coming report, guys, or the coming event that you have, just to get a bit of a comparison there. Then we have something for Johanna. Can you read this? So do you have results regarding the staff that work in service and care and their use of technology and support to the older users? So I guess this is digging a little deeper into this skills issue. Maybe it needs to be more included in the education programs for nurses and for staff working in elderly care, to actually how to use these tools in a smarter way.
And I think it's good to read the report and the case story reports, because I know that there are some parts in about those difficulties, how the staff are experiencing the use of digital tools in their work. So it would be good to see the report and.
But here, I'm sure there is room for improvement and probably good learning for all municipalities to make sure that there is elements of this in the training of staff, how to use the tools. Bing, you know.
Yeah, no, I don't know. But going back to Johanna mentioned that in the beginning, you work with seven regions in a prior project. Three of the regions, but go on one was Exoter region in Finland, that they have come very far using these several digital tools for quite a long time. And we did interviews in another project in this larger project of EOPD, how their situation are working with digital solutions, how their environment are, what they think, and they said all that they don't want to go back. This is the way we want to work. But then we asked the AR management and the directors, do you when you look for new stuff, when you have the explanation what they will do, you present that they will work with the digital tools? No. So it's a surprise when nurses come into the organization that 40% of your work is working with digital tools. They didn't know that. That was a surprise. First they were, what's this? And then they go, very good. But I mean, we need to highlight that we work with digital services from the beginning here to prepare the staff that this is the way we do it.
Definitely, yes.
I think in connection with that, because I was doing some interviews in the Exoter region in Finland within the other project, and I think it was also mentioned that because they have at the local university, they have educational programs for nurses, and they try to include the use of these digital tools that were used in the Exoter region already in the educational programs. So they had that kind of kind of collaboration that seemed to be fruitful, but of course more could be done.
We can add also, or we will add to the email after this with the reports and with the presentations. We will also add links to these previous reports so you can find out more about these different regions. I have another comment here. Results of loneliness and ICT use are ambivalent a recent study shows. Thank you for sharing this. It's always good with new reports here as well. And then what do we have in the other question? I often read about interventions to alleviate loneliness and social isolation. Research have shown that it could be fruitful to separate the two concepts as they can be conceptualized as different in essence. Is this something that you can see as extra important when conducting research on feasibility and effectiveness on these interventions? So to differentiate between loneliness and social isolation. I know you've written quite extensively about this in the report, Johanna, right? We didn't have time today to present it, but maybe you want to comment on this. And it's true, so thank you for this is a good, important comment here. It is two different things to some degree, at least. What would you say?
Yeah, I think it was mentioned in the literature review part of the report,
Exactly.
but it may be also different when separating between the different concepts, because some people, they may feel lonely even if they have quite a large social network, and then it's also the other way around. Some people may have only very few contacts, but those contacts may be very good qualitative sense, and then that people may not feel that lonely at all.
Exactly.
So it's, I think it's good to
and
take a look at the different
social
concepts.
isolation could also be caused by other obstacles, not always just psychologically, but actually also like you live very remotely or you have some physical disabilities that might also become a problem. So comments from your side here?
Yeah, for example, in our upcoming reports, we have looked at a little bit of different types of interventions, and they can be really, really simple. Also, for example, in Iceland, they decided it's really important to clear the snow really fast so that people can get out of their homes. So that's one type of example to try to minimize the social isolation, but it doesn't mean, of course, that it's going to like diminish their feelings of loneliness in that sense.
No.
But you can always try to make these possibilities for people to meet
so
up.
the enablers to make it easy and lower the bar, so to speak, to come out and be less lonely or less isolated. In your research and when you talk about the technologies, do you look at different technologies for reducing loneliness versus social isolation?
No, I can't really say from my perspective, but I know that the researchers in this area, they do. But we need to, I think this is very important. It's very good that we discuss this because the definitions here are different. So we need, this is educational to put this out, to learn about this, because this is important, because you often use these social isolation and loneliness in the same meaning the same thing, but it isn't really. So I mean, it's very important to look at these definitions, and also look into these definitions when we looking into research using these kind of services. Absolutely, because
and also different definitions of loneliness.
Like absolutely.
Some type of loneliness that can be I'm not sure about the terminology, but really like more like on a level that is really hard to catch, that like on a deeper level loneliness, and then something that is just caused by lack of contact. So
it is a bit different.
Yeah,
I'm a bit curious. I also think from a Nordic perspective, which is of course part of our DNA here, working with Nordic collaboration. What do you think is the biggest value of Nordic collaboration on this issue? Besides the fact, of course, that we do have a similar problem or challenge in the Nordic countries with a lot of loneliness and social isolation among the older population. But it also comes to mind as a cultural issue in the Nordics that we do tend to isolate to some degree. I mean, it's a lot of people, also younger people, who feel lonely, and it's something about our social skills and social interaction. So can we actually learn something from each other? Are we all as bad as this, if I put it that way? Or how can we see this? What can we learn And this is also a cultural issue, as I would think.
Absolutely, we can learn a lot. That's why I work in the Nordic cooperation. It's a little bit competition, and it's also very much learning of networking between each other. I think, for example, what's going on in Finland right now, they're counting down the days, time, minutes, seconds to the well-being service counties to be established, and just that they are called well-being service counties. I think that's interesting. We look into Finland and see that Finland have another perspective, more holistic perspective, and also comes to using digital solution. I think loneliness and social isolation is a natural discussion platform when it comes to using digital solutions in Finland, as we don't really see in Sweden. We can see it. You mentioned one product in Norway that comes from a company in Norway also have focus on this. So it differs a little bit. We can see that in Denmark they work a lot with platform for breaking social isolations, trying to make people activated through the digital solutions. So not focusing extra much than on, as I see it, on, yeah, of course they work with loneliness, but so we see differences here, and I think we could pick the good examples and learn from each other. So I mean, there's and we heard about Iceland, that the older adults are more digitalized on Iceland than they are on the rest of the Nordic countries.
Yeah, please tell us more.
Exactly. That's very,
I think the
very
pandemic
important.
has had an impact on that fact. Absolutely.
And Iceland is, of course, one of the most sparsely populated areas as well in the Nordic region. So you have a lot of good incentives to work with digital tools. I don't know, Kaisa, from your work, what do you see as the main benefit from the Nordic perspective or Nordic collaboration perspective?
Yeah, I can just agree with Bent. I mean, and you said also it's part of our DNA working with this. And I mean, we just need to keep our eyes open and not do the same mistakes as others do, and also find good solutions from other countries. And of course, the Nordic countries being so in many ways similar, it's a fruitful base to compare. And also I want to raise, of course, looking at, for example, the Baltic countries. Estonia, for example, is really has gone really far in digitalizing their community, and we have to look a bit further away as well.
Yeah, I was going to say maybe we should also look at those countries who are really good at socializing, like further south in the European countries as well. That would be interesting. Maybe that's another study. Someone here commented, loneliness is a crowded room. Yes, it can be possible to feel lonely also in a crowded room. Of course, we need icebreakers, and we need ways to start opening up to others, and we also have a certain level of shyness, I think, in many people in the Nordic countries. What else we have? The share of lonely older adults is smallest in the Nordic countries from all European countries. That is also an interesting perspective then.
That's true.
That is true.
Yeah, that is true.
So we are not doing so bad, or we're just
No.
used to being lonely.
Yeah, is that the individualist society we have?
Yeah, could be so.
Yeah. Comment further, you who wrote that comment. It's interesting. Why do you think it's that way? Yeah, I'm just prejudiced and thinking that it would be more fun to be old in Spain, but maybe that's not even true.
But yeah, and also what research showed was what I mentioned, that perhaps also this pandemic, when people that are used to being lonely, some of them felt even less lonely because other people were in the same situation. So it's not just that everything has gotten worse during the pandemic, but they felt that they were in the same boat somehow, and there was some type of resilience. And I'm not sure that's the case, like, for example, in the Southern European countries where they are used to having family around all the time.
That's true. So it was a bigger difference for many people in other cultures when they couldn't meet as they are used to. Probably a very important perspective. What else do we have here? I also thought to be the devil's advocate here a little bit and say, what would you say to skeptics who say that digital tools is just a way to save money? Is it really a remedy or really good for older adults, or is it just...
Well,
resource
we could see
saving?
at the initiative looking into cost effectiveness, etc., into this, see that we don't really get there. I mean, we need to invest to use the digital tools, but we can't really save money here. So there is no really what we do. We could prioritize, for example, what we do in home care or in municipality organization. The prioritize on doing putting our efforts, the analog efforts, the physical efforts on other things that is more needed. So we move sort of what we do, and it is also a way of handling the upcoming situation, because we need more hands. We need more people, but where are those people? It's very hard to recruit them. So it's really not about saving money, because it isn't saving money. You need to invest to manage the situation we have now and further on.
So it's not the money-saving tool. It's a complement to existing efforts and to make or improve the care situation. Then, and then talking about funding, do we have any? As a final question, we're almost running out of time here as well. In terms of creative solutions for funding, you bring up an example here where in Huddinge they actually shared iPads between the schools and the elderly care
Storuman.
in Storuman,
Yes.
sorry. So I thought that was quite innovative, although it seemed like both the elderly and the students would need those iPads. But I thought that was interesting. How do you share the resources within the municipality or between municipalities? Do you have any interesting examples of how to raise sort of the resources needed to do this investments?
I think there is much more to do there. I think collaboration between a municipality could be on much higher degree. It has nothing to do with digitalization, but I think, for example, in Sweden, a school, when you go to school, you get lunch for free. Couldn't you invite older people to come and eat with the children? I mean, that's not a digital tool, but I mean, there's a lot of initiative.
That's a social tool.
Yeah, it's a
Yes.
social tool, breaking isolation and so on. So I mean, I think you need to think innovative and see the resources you have and try to establish new things of doing things.
And what was the story in Storuman with this sharing of devices? Do you know any more of the background to this?
No, I think it was because I don't remember if the schools were closed or so, but the students were not using those.
So maybe there were extra devices.
It may be the case,
Yes. And that is also often the case, right? You upgrade in certain departments, and then oops, we have a lot of still functioning, but not the latest version of tools. And then why not reuse them in other parts of the municipal organization? That's super interesting. Maybe a final comment from here. Well, that was the cultural individualism that we already talked about. So with that, I don't know if you have any famous final message that you want to convey. Otherwise, I think we learned a lot from this discussion, and big thanks to you in the audience for contributing and listening in today. And as we said, we'll share our contacts, the reports, etc. from today. But also please get in touch if you want to know more. And as we said, Kajsa and Bengt will continue this work in the coming year and years, maybe in your case specifically with the welfare technology, as it's a long-term ongoing development happening. So with that, thank you so much for participating today. Bye-bye.